Good afternoon, and thank you for joining us for our webinar, Employer's Guide to Health Savings Accounts. My name is Julia Goebel, Chief Marketing Officer at benefitexpress, and I will be your moderator this afternoon. First, I'd like to extend a warm welcome to the current benefits administration clients and our broker partners who have joined us today, as well as any new guests who might be dialing in for the first or second time. To everyone on the line, thank you all for attending. We hope you enjoy the presentation. A few housekeeping items before we get started. If you missed something, don't worry. We'll be emailing you the recording and the slides after the webinar concludes. I'll be keeping the webinar muted to avoid any background noise. And we'll pause throughout for questions. One of our attendees' favorite thing about this format is that we allow questions and ask for your participation throughout the webinar. You can see on the webinar controls that you have an option to type a question in the box. I will read the questions aloud and ask for Larry's perspective. And if we don't get to your question today, we will be sure to email a response. Now to our topic. When it comes to managing employee benefits, employers are frequently turning to high-deductible health plans to help control costs. Not only does this approach allow employees to have greater control over their own health care, but when paired with a solution like a health savings account, also helps employees build funds to cover expenses until their deductible is met. But managing and keeping up with HSA requirements has its difficulties. To help review areas such as eligibility, contributions, distributions, FSAs, and HRAs, we've asked ERISA attorney Larry Groo-gene to present today. With more than 35 years experience in employee benefit law, Larry has a wealth of experience in dealing with qualified plans, health and welfare matters, fringe benefits, and executive compensation areas. He is a frequent speaker and author. He is an adjunct faculty member of John Marshall Law School's LLM program in employee benefits and at the Valparaiso University School of Law, and teaches a number of courses. He is also a member of the Indiana and Illinois bars. Before we get started, let's take a quick poll to see if there are any common pain points that our audience shares. If you could please take a moment to read and select an answer from the screen, that would be much appreciated. And this will help us gauge how the audience is currently thinking about these items. So to read the poll, what is your biggest pain point with administering HSAs? Is it driving employee participation? Providing employee education and communication, keeping up with compliance requirements, reviewing, auditing, and processing claims for reimbursement, or something else? If by chance none of the above fits your current challenge, we'd be interested, and feel free to chat that to us for our reference for future planning. We'll leave the poll open just another moment as we look at the pain points on the page. What is your biggest pain point with administering HSAs? And we have quite a horse race, which is a little topical after the Preakness over the weekend. We are seeing two of the choices neck and neck, and in just a moment we will close the poll. With over 70% of you voting, we have just another minute or two and then we'll close the poll. Great, so with that, I want to close the poll and share. 35% of you indicate that driving employee participation is your #1 pain point, and 36% say providing employee education and communication is your #1 challenge. So it's clear that whether it's employee education or participation, these are the areas of focus, and we hope that in the next few minutes together we'll help answer some of your questions and perhaps shed some light on these areas in addition to the important compliance topic we're about to cover. And with that, I will now hand it over to Larry to get started. Take it away, Larry.
Thank you, I appreciate it. What's interesting about HSAs, and I've been involved in since the beginning, 2004, this is a slightly different type of account that most employers are used to. Most employers are really involved with other accounts. They either sponsor them or they have somebody else administer them. Well, the HSAs are more or less like a medical IRA. It is the responsibility of the employee to take funds out, make sure they have excess, they take care of excess contributions. The employer generally has nothing to do how the money is spent. It's hands off. So it's a very interesting relationship between the employer and the employee in this, because the fact that you can't be involved and the employee has to understand what their responsibilities are. And that's where it gets pretty interesting for the employers, because they don't want to get involved too much because it becomes an ERISA plan, but they still want to educate the employees to understand what their responsibilities are. So that's a dilemma in HSAs. Today we're going to be discussing just a whole range of topics. And like I did last month, what I'm doing is I'm presenting a list of questions and we're going to be talking about it. At the end of each section that we talk about, I'll pause for a second, see if you have any questions. And so therefore, you're going to really understand what the challenges are. This presentation is based on the questions I've been getting from my clients. I represent a lot of brokers, a lot of TPAs, and they ask me a ton of HSA questions. There's areas in each of these that can be somewhat complicated. So it's a challenge to understand how to advise your employees of exactly how to deal with HSA. So the first area I want to talk about is eligibility. Can self-employed individuals, such as partners and S-Corp shareholders, contribute to an HSA? This is a common question I get all the time, and they can participate. So this rule is different than a health FSA. Now the rub is, and this is something that you have to understand, the shareholders and the self-employed individuals can participate, but they cannot participate on a pre-tax basis. So any contributions they make to an HSA will be on a post-tax basis, and then they will receive a deduction. They will take on their 1040 for the HSA contribution. So because they cannot contribute to a cafeteria plan, the HSA contributions cannot be pre-tax. But again, you still can contribute, no problem, but it's on an after-tax basis. Next, if an individual's expenses can be reimbursed under a spouse's health FSA, does this make the individual ineligible to contribute to an HSA even if no expenses are submitted? And the answer is that the individual employee would be prohibited from contributing to an HSA. And this is something you should notify your employees about, because if a spouse is participating in a health FSA, and if he or she could submit expenses on that employee's behalf, technically that makes that individual that expenses could be submitted for ineligible to contribute to an HSA. So please, this is one area that you should inform your employees who are participating. Hey, ask your spouse if they have a health health FSA, and generally, in most health FSAs, the whole family is eligible. So just because you don't submit any expenses doesn't mean that could affect your employee's ability to make an HSA contribution. So please, this is one area I would submit, and I get this question a lot. Because the employees say, well, my employer never told me this. So, I mean, there should be a general statement in your HSA material about, hey, talk to your spouse about this. Can an employer participating in a health FSA elect out of participating if he or she enrolls in a high deductible health plan in the middle of the plan year? And this is a very common question, because many employers have a health plan that is not on a calendar year basis. And an employer, well, what they will do is have an enrollment in the middle of the year, but their enrollment for the health FSA is on a calendar year. So in this situation, there's a problem because the fact that a change in cost and coverage is technically not a qualifying event to change your election under the health FSA. So if my employer instituted a new high deductible health plan in July, and I participated in January to contribute to my health FSA, technically the employer cannot give me, or I do not have an election to elect out of it. The law does not permit me to elect out of it just because of change in coverage. Now, what the employer could do, they could amend the health FSA to be a limited purpose health FSA, and therefore allow that individual to contribute in the health FSA, be a limited purpose, which is only medical, dental, and preventive care, and then they could then contribute to an HSA. But again, it has to be an employer action, not an employee action. The health FSA would have to be that would have to be amended to make it what's called a limited purpose health FSA. So please, I get this question at least 4 or 5 times a year, and this is a very, very common situation. So just make sure you don't allow employees technically to change their election, because again, a change in cost and coverage is not a qualifying event to change your election under a health FSA. All right, Julia, are there any questions so far?
Larry, not yet as of this point. As a reminder, everyone, we would welcome your questions as we proceed. We'll pause on each slide for an opportunity to ask and answer any questions that we'll handle here live. So none at this time, Larry. Let's move on.
Thank you. Now, the next question I get, all right, if I participate in any of the areas that you see here, does it make an employee ineligible to contribute to an HSA? Because remember, there cannot be any coverage below the deductible for a high deductible health plan. That's $1,350 and $2,700 for 2019. So you can't have any coverage. So employee assistance program, it depends. On an employee assistance program, if the program is considered a medical program, in other words, it provides counseling, and this is something that the employee provides for you either through a life insurance or disability, and that coverage is, they pay for it below the deductible for a high deductible plan, that could make you ineligible for an HSA. General purpose FSA, yes. It would make an employee ineligible to contribute to an HSA because there can't be any coverage. Limited purpose HRA. And a limited purpose HRA is, again, only reimbursing dental and vision and preventive care below $1,350 and $2,700. Above that, it can be a general purpose HRA that reimburses everything. Telemedicine benefits. Telemedicine is becoming very popular, and there's not been an official IRS ruling on this. There's various opinions on this. I think if the employer pays any part of the premium for providing telemedicine benefits to the employee, then I would think that would make an employee ineligible to contribute to an HSA, because most of the telemedicine programs that I've seen are their medical programs under ERISA. I've written plan documents for some companies that provide medical telemedicine benefits. And most of the doctors can prescribe drugs. It's pretty robust programs. So in this situation, if the employee, for example, gets any break on the visit, in other words, the employee doesn't pay for any part of the visit, whatever cost that is, then that would make an employee ineligible. So if the cost per visit is $25 and the employer picks up any piece of that, then it would make the employee ineligible. Dependent care assistance, it doesn't matter, it doesn't affect it, no problem. Wellness programs, and again, it's one of these things when there's no bright lines here. And if the wellness program is considered to be a medical program under ERISA, then it would affect your eligibility to contribute to an HSA. And again, a wellness program, for example, that provides any kind of testing would be considered to be a medical program under ERISA. A discount drug program, no, it would not. A discount drug program would not, because it's not coverage, you're just getting a break on your drugs, so that would not be considered coverage. Medicare, you have to be enrolled in Medicare in order to affect your HSA eligibility, but you have to be enrolled. Just being eligible for it is not enough. So if you enroll in Medicare, at the beginning of the month, that month, you're no longer eligible to contribute to an HSA. Adoption assistance program, no. That would not affect at all. Qualified small employer HRAs, these are new HSAs, have been around for a couple of years. HRAs, excuse me. And in that situation, if it's just paying for premiums, not for expenses, and the coverage is a high deductible plan, that would not defeat the eligibility to contribute to an HSA. If the plan does reimburse expenses below the deductible for a high deductible plan, then there's a problem. VA medical benefits, there's special rules in regard to that. In some situations, VA benefits will not deter. There's special rules on that. So just look at that and see what those, that was changed a few years ago. On-site clinics, again, is coverage below the deductible, and if the employer picks up any part of that visit on an on-site clinic and it provides assistance beyond just first aid, then in that situation it would make an employee ineligible to contribute to an HSA. So again, it's very tricky. There's all kinds of different benefits you have to look at, but these are the most popular ones I run into in my practice. Julie, any questions so far?
Yes, I have one from Edwina. Thank you for asking a question. It is, if the telemedicine is part of the medical plan and the employer pays part of the medical premium, would the employee be ineligible?
It all depends on who pays for the visit. If the employee, if part of that premium is that the visit is paid for by the premium, then I would think in that situation it would be coverage just like any other coverage. So if you go, right, go ahead.
And if the employee paid for the visit, then?
If the employee paid for the visit, then it would not defeat the eligibility. But if, for example, if the employee just had a copay because the employee paid for part of it, then that's coverage below the deductible.
Okay.
All right.
Thank you.
Now let's look at contributions. Contributions can be very complicated. How is the amount of the HSA contribution determined on a calendar year? It's based on your eligibility. The only thing that determines the HSA contribution is monthly participation in a high deductible plan. So it's months of participation in a high deductible plan. That's how. So we look at each month to see if you are participating in and what coverage you had during those months. So you had single or family coverage, that would determine how much of a contribution. So whatever the yearly limit is, you divide it into 12 and you look at each monthly situation, and that will determine how much you can contribute to an HSA. Now, can an individual contribute the full amount of the for a calendar year if he or she does participate in the high deductible plan at the beginning of the year? So, and again, it's the full amount, but another question, I think a better question on this, is that suppose you didn't start at the beginning of the year. Suppose you started in July of that year, and your employer, for example, instituted a high deductible plan in July of 2019. What can you contribute? Now, there's two ways to contribute, in that situation. One way is to just do 6/12 of the annual limit for whatever your coverage you have. So if you have single coverage, it's 6/12 of the single coverage rate, or 6/12 of the family rate. You have family coverage. There's a special rule under HSAs that say if whatever coverage you had in December of that year, you can then contribute the full amount for the year. So if you're, for example, if your employer didn't adopt a high deductible plan until December of 2019, this rule would allow you to contribute the full amount for 2019. But what the rule says is that you have to stay in the high deductible plan to make that full contribution for the rest of the calendar year, the next calendar year, 2020. So anytime you participate in a high deductible plan in any other time other than the beginning of the plan year, this rule applies. So in my case, if I started in July of 2019, I could either contribute 6/12, whatever coverage I have, that limit, or 12/12. But if I do 12/12 for 2019, then I have to stay in the high deductible plan for 2020, or I will be penalized. So please understand that. And this is something, especially if you have a open enrollment in the middle of the year, this is going to affect how much the employees can contribute. What can a family contribute for a calendar year if they cover children under age 26 who are not tax dependents? This is a very interesting rule. I get questions all the time. Suppose you had a family with two sons, 24 and 25. They're not living at home. They're on their own, but the parents decide to cover the kids. Now remember, because of ACA, these children don't have to, again, be tax dependents. They don't have to live with you. They can be covered to age 26. All right. And because they're not a tax dependent, they're individually eligible to participate and contribute to an HSA because they're covered by a high deductible plan. In that situation, you could have, for example, since the family has family coverage, the husband and wife can contribute $7,000. Each son can contribute $7,000 on their own and get a deduction for it. So this is something that's really interesting, and it's an interesting development of ACA because kids are staying on their plans past age 21 or 22. And in many situations, these kids are not tax dependents. So remember, in this situation, the parents, because they're not cannot reimburse their expenses, but they can have their own HSAs, which is real interesting. All right, next. By what date must an individual correct excess contributions for a calendar year without penalty? You have until the due date of your tax return, April 15th, for example, for 2019, for 2020, to both contribute and remove any excess contributions. So again, if you can't decide how much you're going to contribute to an HSA, you have until April 15th to contribute your contributions for the previous calendar year. Most people can't wait. They contribute early in, for example, 2019, and then their situation changes. They change jobs, they change coverages. That contribution they had at the beginning of the year is an excess contribution. You have until April 15th of the following year to make a correction. And if you don't correct it by April 15th, there's a 6% penalty. For each year that money stays in your plan, that's an excess contribution. So please understand that. So when do contributions have to be made for a calendar year? Again, and I indicated this, by April 15th of the following year. So for 2019, I have until April 15th of 2020 to contribute for 2019. Okay? Other contribution questions. If an individual covers a spouse who is enrolled in Medicare,
Oh, boy.
can he or she contribute up to the family limit to his or her HSA? And the question's yes. The dependent doesn't have to be eligible to contribute to an HSA. Only the individual employee has to be eligible. So if he or she, the employee, is covered by a high-deductible plan, it's not covered by anything else, the dependents, either children or a spouse, don't have to be eligible. Now, the upshot of all this is the fact that all the contributions have to be made to the employee's HSA. The spouse who is enrolled in Medicare can't get any HSA contributions. They're not eligible. So this is extreme. This happens all the time, and this is a very common question. Can a friend or relative contribute on behalf of an individual who is eligible to contribute to an HSA? And the answer is yes, but the individual that you give it to can take the deduction. You can't. So if an uncle or a grandparent or a parent contributed for you and gave the money to you to contribute to an HSA, they don't get the deduction, you get the deduction. How often can an employee change his or her HSA contribution amount made through a cafeteria plan? And the regulations say you have to be allowed to change your election under a cafeteria plan at least once a month. So this is something that the cafeteria plan has to provide. So you can change your HSA contribution at least once a month. Can an employer make matching contributions to an employee's HSA account? And the answer is yes, but it's got to be made through a cafeteria plan. If employer contributions are not made through a cafeteria plan, there's something called the comparability rules. And basically the contributions can only vary depending on the coverages. So outside of a cafeteria plan, the employer cannot contribute matching contributions. It has to be made through a cafeteria plan, and then you have to pass the cafeteria plan non-discrimination rules. Can an individual contribute his or her HSA by using monies from his or her IRA? Yes, you have a one-time deal. You can do that. You can transfer money from your IRA to your HSA. If you do that, of course, you don't get a deduction for making that contribution. But again, you turn taxable IRA money into non-taxable HSA money if you use it for medical expenses. So you lose your deduction, but you can transfer money from your HRA to your HSA. It's possible to do so. Okay. Julie, I'm sorry. I knew I had another slide, so I just wanted to.
Yes, of course.
I finished the section.
Yeah, so we're seeing a lot of interest and discussion around the contributions topic. So let me take one first from Michelle, who shares and comments, regarding the 4/15 tax deadline. Some custodians set earlier deadlines for when the funds have to be received in order to process by the filing deadline.
That's an internal thing. The law says April 15th.
Okay, so good clarification.
You can just find a trustee that will accept that money, or custodian. As long as you put into an HSA by that date, you're fine.
Okay, very good. This one's from Beverly. How often can employees change contribution with an FSA? Now, I know you're going to get to FSA in a moment. Is that one you'd like to cover now or in the future?
Well, no, repeat the question again. I'm sorry.
How often can an employee change contribution amount with an FSA?
Well, it depends on the terms of the plan. And basically, an HSA is under and a health FSA, because that's a different story. But it depends on the terms of the plan. It depends on how often the employer allows you to make changes to an HSA. Technically, if the employer drafts their document, they could say you can make no changes to your health FSA during the year. Mm-hmm. Now there's 5 or 6 different qualifying events that has to occur for you, you can't just willy-nilly make a change in your election to your health FSA. So there has to be a qualifying event. Those qualifying events are stated in your HSA and your FSA summary plan description. So unless you have one of those qualifying events, you can't change your health FSA election.
Okay, great.
Now again, clearly as I indicated here, under an HSA, the employer, if you're contributing HSA money on a pre-tax basis through a cafeteria plan, the employer has to allow you to change your election at least once a month. So that's a different section of your cafeteria plan. Health FSAs are one section, HSAs are another.
Good. Here's one from Kimberly. What does it mean when you say lose their deduction when you move money from an HRA to an HSA?
Well, let's say you could contribute let's make it easy. Let's say you can make $3,000 contribution to your HSA, and you decide you don't have the cash to do it, but you have an IRA. All right, you can take your IRA, notify your IRA trustee or custodian, say, move that $3,000 over to my HSA account. Now, if you do that, all right, you're turning taxable IRA money into non-taxable HSA money if you spend it for medical expenses. That $3,000 cannot be deducted from you because it's coming from an IRA, because you already got a deduction for your IRA. You can't double dip. All right, so you got a deduction for the you just change the money from being an IRA to an HSA. So therefore, that year that you make a contribution, you can't again get a $3,000 deduction for transferring the money. That's what I'm trying to say.
That's helpful. And then last one, and then we'll move on to the next area. This one is from Kaylee. Can you transfer money from a 401k to an HSA?
No. Years ago, I think up until 2011, you could transfer money that was left over in an HRA to an HSA, but that was done away with in 2011. Same thing with 403b. You can't do 403b. The only account you can transfer is, and it's still in the law, you can transfer money from an HRA to an HSA.
And that helps that clarify. And I actually do have one more regarding Medicare. What are the rules for Medicare eligible active employees? Can they continue to contribute to an HSA?
No, and I have a special section, but I'll just mention it right here. Once you become eligible for Medicare, not eligible, enrolled in Medicare, that puts an end to your HSA eligibility. So once you enroll, that stops your HSA. Now, one thing that's extremely important is if you are participating in an employer group health plan, you can delay your Medicare eligibility. When you lose your employer coverage, you then can enroll in Medicare. Now, there's a special rule under Medicare saying if you enroll past 65, there's a special 6-month rollback that now they will enroll you 6 months before. If that's the case, then that makes the contributions you made in your HSA contributions for 6 months now excess contributions. So if you have any employees that are past 65, let's say they're 70, 72, and they decide now I'm going to enroll in Medicare, warn them. If you enroll in Medicare now, there's going to be a 6-month pullback, and they will enroll in Medicare 6 months before. If that's the case, then now you have 6 months of excess contributions to your HSA. I will cover that in the next few minutes.
Sounds good.
Any other questions?
Yes, just one clarification. Can HRA be can HRA money be transferred to an HSA? And this is from
No.
Lindsay. So
No.
no.
There was a provision that expired in 2011. If you had money left over at the end of the year, if the employer allowed you, you could transfer your HRA money over to an HRA, but that's been gone for at least 7 or 8 years.
Okay, let's continue.
Okay, let's go through distributions. Can a participant reimburse an expense that he or she has incurred in a prior year but was not reimbursed? And this is one of the key differences that HSAs have different than FSAs. You can save up your expenses, for example, and any expense that has incurred after you've established your HSA can be reimbursed at any time for any reason. But I would advise your employees and advise them to keep your receipts unless you get audited. So this is the first question is a major difference from FSAs to HSAs. And to illustrate this, I have a very interesting situation. An individual withdrew money from his HSA to buy a big screen TV, but he or she had medical expenses in the past that had not been reimbursed. Is the withdrawal taxable? And the answer is no. Because you can save up your expenses, you could use this as long as you had expenses in the past and you didn't get reimbursed for. What this illustrates, you can use it for any other purpose. Your HSA could be a college fund. As long as you had expenses that you weren't reimbursed in the past, you could use it for any reason. And that question illustrates, now one of the biggest misconceptions in regard to distributions from HSA is the fact that, let's say you had an individual that had single coverage, and they want to reimburse expenses of their dependents and their spouse. Just because you have single coverage doesn't mean you can't reimburse those expenses of your spouse and children. That single coverage only determines your contributions. It doesn't determine your distributions. So again, please understand that. That's a misconception I have all the time, that if I single coverage, who can I reimburse for? Or anybody who is your legitimate dependent or spouse can be, if their expenses are not reimbursed, you can reimburse them. Now, can an individual be reimbursed for an expense incurred in a calendar year before the HSA is established? And the answer is no. It's only those expenses that have incurred after HSA is established. So please understand that. Anything after that is fair game. Now, can an individual be reimbursed for COBRA premiums? The answer is yes. That's one of the exceptions, one of the premium exceptions. You can do that. Julie, any questions on distributions?
Not specific to distributions. I do have a follow-up on Medicare.
Mm-hmm.
Isn't enrollment in Part A automatic? How can one opt out?
No, you don't enroll. It's not automatic.
Mm-hmm.
You have to enroll in A and B. Now, A, there's no premium for A, but it's not automatic. You have to enroll in parts A and B. And many people enroll in A because there's no premium and then wait to participate in B, but it's not automatic.
Very good. Thank you.
All right. Well, I've been talking about this term, limited purpose health FSA. Remember, a limited purpose FSA just reimburses dental, vision, and preventive care. Those are the only expenses. And again, if you do that, then you're eligible to contribute to an HSA. Is enrolling in a high deductible plan during a calendar year a qualifying event to drop participation in a health FSA? And this is a question I had before. I bring it up again because it comes up year after year after year. And the answer is no. A change in cost and coverage is not a qualifying event to change your election under a health FSA. So please understand that. So if your employer has a enrollment in any month in a year other than January, and you're enrolling, and previously you enrolled in a health FSA, in order for you to participate in an HSA, you have to basically, the employer has to change the health FSA to allow you to participate in an HSA. Once you do, until that health FSA year is up, you're not eligible. Can an employer amend the health FSA to be a limited purpose? Yes. The employer has that ability to amend the plan, but it's got to be an employer action, not an employee action. Will having a carryover amount in your health FSA make an individual ineligible for the entire plan year? And the answer is yes, even though you spent your carryover money the first few months of the next year. You decided that you're not going to participate in 2020 in the health FSA because you've enrolled in a high deductible plan. Unbeknownst to you, you had a carryover amount of $300. And you decided to use that $300 in the first few months of 2020. It doesn't matter because that amount carried over. Now you're ineligible for the entire calendar year to contribute to an HSA. So, I mean, these are things and these are areas that employees have to understand, that the fact that it can get rather complicated. And a few $100s could deter them to making HSA contributions in the next calendar year. That's the problem. And again, does it change the answer if the individual spends the carryover amount before the end of that year? And the answer is no. As my example said, now if you have no carryover amount, again, you're golden at the beginning of the year. But again, if you have any amount remaining at the beginning of the next calendar year, it makes that individual ineligible to contribute to an HSA. Can an employer reimburse medical expenses under an HRA above the deductible limits of $1,350 and $2,700 if the employer's group health plan has higher deduction limits? And the answer is yes. So suppose you had an employer that had a $5,000 and $10,000 deductible limits. The law says that you cannot receive any reimbursements below those $1,300 and $2,700. So despite the fact your employer had higher limits, doesn't matter. So you could have an HRA that, again, reimbursed amounts. For example, if you had a $5,000 or $10,000 limit, it could reimburse amounts above $1,350 and $2,700 with no problem, and you could still be eligible to contribute to an HSA. Will COBRA coverage under an HRA make an individual ineligible to contribute to an HSA? Yes, if you're reimbursed. Will an individual be ineligible to contribute to an HSA if he or she is eligible for HSA coverage but does not receive any reimbursements? And that first one, I'm sorry, is a typo. Should say HSA. I read over 5 times, I didn't see it. Will an individual be ineligible to contribute to an HSA if he or she is eligible for coverage but doesn't receive? If you could receive reimbursements, that makes you ineligible. That's the problem. That's the problem. Now, these are the questions on Medicare. And this is extremely important. Can an individual still be eligible to contribute to an HSA if he or she is eligible to enroll in Medicare but chooses not to enroll in Medicare? And again, what determines HSA eligibility is actually enrolling in Medicare. Just because you're eligible doesn't matter. But as soon as you enroll at the beginning of that month, you enroll in Medicare, it makes that individual ineligible to contribute to an HSA. Please understand that. So what are the consequences if an individual enrolls in Medicare after age 65? And the answer is that 6-month rollback. So if you're age 70 and you enroll in Medicare for the first time, there's a 6-month rollback, and you're deemed to be now eligible 6 months before. And if that's the case, you have excess contributions under your HSA for 6 months. So again, as an employer, I would if you have any employees that are over 65 working and going to be enrolling in Medicare after age 65, you have to warn them the fact that enrollment in Medicare after 65 could affect your eligibility for HSA contributions for a good 6 months. So please take that in consideration when you're enrolling. And it goes back to the time I indicated to you about excess contribution. So if it's determined you have an excess contribution, you have until again April 15th of the following year to correct it. All right, can an individual be reimbursed for Medicare premiums after age 65? And the answer is yes, you can. But if you have a spouse, for example, who is under age 65, who is participating in an HSA, and a spouse is over 65, until that HSA participant reaches 65, they cannot reimburse the medical expenses, the premiums for that older spouse. So if a spouse under age 65 has an HSA, they have to wait until they're 65 to actually reimburse the medical expenses, the Medicare premiums of their older spouse. So these are things, again, the problem is that employees may not know, and you have to educate them of some of the nuances in regard to distributions in Medicare that can get rather complicated. Julia, do we have any questions? I skipped a couple places.
I think let's continue. Nothing specific to Medicare. We do have a few general questions we can cover as we continue.
All right, just bear with me a second. These are administrative issues. Can an employer establish an HSA on behalf of the employee? They can if you have employees that for some reason you ask them to establish an HSA. I'm going to give you a contribution, please do so. It comes with all kinds of issues and problems because the fact that if you establish something on his or her behalf, one of the items you have to fill out is a designation of beneficiary form. Who's the beneficiary? His estate? So I'd be very, very leery about doing that. It comes with all kinds of issues and problems. Can an employer limit the medical expenses that can be reimbursed under an HSA? The issue in that, when you start putting restrictions how the money is spent, you're turning the HSA into an ERISA plan. And as an employer, you don't want to do that, because one of the beauties of an HSA is the fact that there's very limited in employer participation in an HSA, and you want to keep it that way. And it's very cost effective. But the flip side of it is that if you have employees that are not educated, they're not used to this, there's more employee responsibility about having an HSA than, for example, a health FSA. You have to educate your employees about their new responsibility. Next, under what circumstances can the employer withdraw contributions from an employee's HSA? Very limited situations, only if the contribution is made in error, where as an employer you thought that employee was eligible and they're not. But any other situations, basically once the money goes into the employee's HSA account, it's theirs. Remember, these HSA accounts are theirs. They can spend it how they want, when they want it. And please warn the employees that they have responsibilities, that they're going to get, they have to do a Form 8889 to report contributions and distributions. The HSA contributions have to be reported under 1040. All this has to be education for the employees to understand what the new responsibilities are. All right, any follow-up questions?
Yes. So one that is commonly asked by many attendees is, how can I access a copy of this webinar after the fact? We will provide a link to the recording as well as the slides so that you have this for future reference.
Now, I will, in the 2020 limits to the HSAs are generally out by now. And every year I produce the employer guide to HSAs. As soon as the 2020 limits come out, I will give it to Julia. Julia will then distribute it to you. All the areas that we discussed today is in that employer guide. It's over 30 pages. It goes into avid detail about all this area, and many employers use it as a way of a cheat sheet and understanding exactly what to do. So hopefully in the next week or so, the 2020 limits will come out. I'll amend my employer guide for last year to this year, and then you'll get a copy of that. It will answer all your questions.
That's terrific. I think that will help our audience immensely. Let me get to a question from Joseph, who asks, if an employee has an ADHP and elects both the HSA and the FSA, is there anything you would recommend to correct this?
Knock them in the head. No, it just make sure they understand. Make sure they understand that if you participate in a health FSA, you can't contribute to an HSA. Mm-hmm. And so therefore, it's going to be they're going to be limited about what they can actually contribute. So they cannot contribute. And the problem, and one of the benefits of a HSA is the money doesn't go away. So if you're going to contribute one or the other, just understand that the fact that under the health FSA, once that year is over, and even if a carryover, you only can carry over $500, but that ends. With an HSA, you can put that money in now and not spend it for 20 years. Wait for an emergency. So there has to be education by you, the employer, to the employees to understand what the pros and cons of each are, so they understand exactly which one's best for them. Mm-hmm. Now, in my employer guide, I have a chart on various factors of each one, and I go through the pros and cons of each account. So you can give it to the employee and say, well, these are the pros and cons, and you should really look at this to understand which one's best for you.
And to that point, knowing that while education goes a very long way, there are rules that can be put in place. And for example, Kimberly shares of the employers she works with, if an eligible employee elects both the HSA and the FSA, they are automatically mapped to a limited purpose FSA.
Okay.
So there are some ways we can help people, but also correct.
Guide them along.
Exactly. This is a common one that occurs because we know so many of our listeners are involved in mergers and acquisitions. And this one comes from Latrina, who asks, what if an employee is enrolling as a result of an acquisition? The new enrollment is effective 7/1. Can the employee hired move from a PPO to an HD-HP and contribute to an HSA?
If it's an asset purchase and they're new employees, are treated as new employees. So if they had a PPO before and they're moving to a high deductible plan, again, you can advise them there's two ways to contribute. You can do a percentage of the annual contributions, a whole amount, but understand if you contribute the whole amount for the year, if you participate in the middle of the year, you have to stay in a high deductible plan for the remainder of the next year. So these are things that you have to explain to the employees, especially any employee that enters your plan other than January 1. And understand that if you enroll in a high deductible plan in the middle of the year, you have two ways to contribute, and try to explain to them the two ways they can contribute.
Great, that's helpful. I know that this one caught our listeners' eyes, and it was the big screen TV example. On distributions, aren't the employees required to submit receipts for reimbursement? And
No.
why wouldn't someone just wait until they have a medical expense and then put the money in or take it out?
It could be the fact that they decided to keep the money in their account, and they were given a credit card under their HSA, and they used the credit card to buy the big screen TV. So in that situation, the only point I wanted to make with that example was the fact that as long as you have unreimbursed expenses, the HSA money doesn't necessarily have to go to reimburse you for those expenses. It can be held in reserve and be used for other purposes as long as you have unreimbursed expenses. Some people, for example, are using the HSA money as a college fund for their kids, but they have expenses they're paying with their out-of-pocket money, but they're making sure, because that money accumulates tax-free, and so this is another way of creating a family fund that could be used for other purposes. And again, one thing that many people are using, they're using their HSA money as a way of funding a skilled care or nursing home expenses. And, you know, I have money now. I can you know, put my money in. I can reimburse my medical expenses now. I mean, I can pay it out of pocket now, but I want to save this HSA money for the future because it's accumulating tax-free. So again, people use it for different purposes. Many people use it on a day-to-day basis. That's fine too. But again, when I'm trying to illustrate the fact it can be used for a lot of different purposes. That's what I'm trying to get at.
That's good. And with that, I believe we've covered the questions that were asked among the group. Really appreciate everyone's engagement. I think this has been terrific.
Take care, everyone, and hopefully you found this helpful.
Yes, absolutely. Once again, thanks for joining this webinar on behalf of benefitexpress. We are so grateful for your participation today, and please watch for next month's webinar, which is sure to be as engaging as this one. Have a great afternoon.
Take care. Bye-bye.